pharmacy owners, Dr. Lisa Foss here, and I have a question for you. What seems to be like the holy grail of pharmacy in terms of like revenue and profit? And if you've been around long enough like me, I would say it's like medical billing. And we call it medical billing now, but it's been called clinical services, it's been called cognitive services. It's basically getting paid for things that aren't just reimbursement on a product that we dispense, right? And I feel like this has been one of those myths, like you're chasing the end of the rainbow and you get to the close, you think you're gonna turn the corner, you're gonna see the end of the rainbow, and then it just moves like all on its own and it's gone. And it's now a mile further than what it was. And I feel like that's how medical billing is. And I've worked a lot on medical billing over the last many, many years. I've worked with associations, I've worked with companies, and the part of the problem is there's no one right way to do it. There's a whole lot of wrong ways to do it, but there's not one right way to do it. And it often depends on your state, your scope of practice, all these kinds of things, what insurance is, Medicaid, are you recognized as a provider? Anyways, it's complicated, right? But what I've done for the Pharmacy Profit Summit that we're having in March in Dallas is I've brought together all of the major companies that play in this sandbox, like everybody, invited everybody, and we're going to have a master session on medical billing on practical how-to. I don't like theoretical talk. If y'all follow me, you know that. Like, I like real solutions to real problems. And I've started to have all of the pre-summit conversations with these guys, and I am getting so excited for this. Like, it is going to be a killer session. You will be able to leave understanding like what to do, how to do it, maybe the best way to do it. All the companies are going to be there. You're going to be able to talk to them. You're going to be able to ask them questions after they all present. We're going to have a huge Q&A session, so that way you can ask questions. We're going to have people who've done it before on there, so it's like real practical. We're going to solve this thing and at least help you get started. And so I'm really excited for that. So if you have any interest in medical billing, clinical services, cognitive services, whatever you want to call it, additional billing opportunities for what's in your brain and how you help your patients, then get your ticket to the Pharmacy Profit Summit. It's coming up in almost just 2 months away. It's March 23rd and 24th, and it's in Dallas, so it's easy to fly into. There's 2 airports, and it's just going to be a wonderful time. Of course, we're going to have lots of fun. There's going to be ninjas. There's going to be lots of other topics. So I hope to see you at the summit. And if you have any questions, pop them down below. And don't forget about our 100% money back guarantee plus $500 if you don't absolutely love it, but I know you'll love it. So talk to you later. Bye-bye.